All right, so when assisting a patient to eat, first thing you want to do is check the medical record to see what the patient's diet is. Then you want to go to the patient's room, perform hand hygiene, don appropriate PPE, introduce yourself, introduce the patient, and let them know what you're going to be doing. Then you want to check the patient's level of consciousness, any physical limitations, if they have dentures, if they have glasses to help them see, cultural or religious preferences, and any likes or dislikes. Then you want to pull the curtain to give privacy and assess the patient's abdomen. Ask them if they are having any nausea or have any pain. If they say yes, you want to provide an antiemetic or analgesic to help them be more comfortable. You want to offer elimination, offer them hand hygiene, and offer mouth care. Then you want to remove any bedpans or any other unnecessary equipment from the vicinity and remove any odors from the vicinity in which they will be eating. Then you want to pull the curtain back open, put the patient in a high Fowler's position in the bed. If they stay in bed to eat, make sure the bed's in a low position, or put them in a chair in an upright position where they're comfortable. You want to place a protective covering over their clothes, such as a towel or a clothing protector. Then you want to set up their bedside table in front of them with their tray on top. Make sure that all hot foods are hot, all cold foods are cold. Make sure that hot beverages, they're cooled down and foods cooled down before you give it to them. You want to assess for any difficulty swallowing. Ask them if they have any difficulty with swallowing. When you're cutting up their food, you want to make sure that you cut it in small enough pieces so that they don't choke. And when you're feeding the patient, you want to watch how they eat, assess for any difficulty swallowing, and you want to, if they do have difficulty swallowing and need dysphagia, you want to limit conversation because you don't want them to cause them to choke. But if they don't have any difficulty swallowing, then it's nice to conversate with the patient so it's not awkward and quiet. Then you can also play some relaxing music if the patient does have difficulty swallowing, so it's not that awkwardness. Once they're done, you'll clean them up. And also when they're eating, you want to see what they can do for themselves. So if it's finger foods or any food in particular, if they can feed themselves, you want to make sure that they can do as much as they can for themselves. Clean them up, remove their tray from the table. Then you want to push the bedside table off to the side, get them back in bed. Ask them if they have any elimination needs. Perform hand hygiene and any other care, maybe mouth care after eating if needed. Then you'll remove your PPE, wash your hands, perform appropriate hand hygiene, and take the tray out of the room.